have been meeting to identify and deliberate on the latest drivers transforming the healthcare industry on the continent. And to discuss this is the Africa Health Leaders Forum is Clyde Lewis, General Electric's Head of Healthcare. Very good evening to you, and thank you so much for joining us, Clyde. Let's just first start with the gathering itself. So it was a gathering of aspirant but also established leaders. But I'm curious, what were the main takeaways from how they can bring more innovation into healthcare in general in Africa?
So I think, Africa has a lot of complexity if you consider affordability, quality of healthcare and accessibility for patients around the continent. So a lot of the discussions that we had and some of the conversations, both amongst the public and the private sector, was very much focused on how to think through some of those discussions. So for example, if you really think about adapted delivery models, there's a lot that can be done in Africa, and really it's about taking care to the patients. So if you think through that in the rural communities and villages across Africa, there's a lot of people there that don't have access to care. And how do you capture and strengthen those healthcare systems? So really focusing on the primary healthcare systems.
Okay, so before we get to the delivery models, let's first start with the uncertainty in the healthcare environment in Africa. Why is there such a great deal of uncertainty?
Well, I would say, first of all, Africa has today 11% of the world's population and 24% of the disease burden. So non-communicable disease is on the rise. It's extremely tough to be able to consider how to be able to manage that. And there's various factors that come into play when thinking through the delivery models and some of the problem statements on how to go about that. And that's obviously a concern for everybody that's within those systems. Healthcare today is really about thinking through how we can deliver universal health coverage and making sure that we don't leave anybody behind on the African continent in delivering those services.
So you spoke about non-communicable diseases earlier on and taking healthcare to the people. So that would be out-of-hospital delivery models. But
correct.
What are the main causes for the fact that we're seeing more and more people living with these conditions, but also for a longer period of time? What are the drivers?
Well, I'd say in terms of the disease itself, obviously there's a rise of non-communicable diseases such as oncology, such as cancer, cardiology, obesity, and other factors. It's very, very challenging to be able to deal with some of those diseases, and you obviously have to have the healthcare systems in place. You have to have the healthcare professionals that are there to be able to serve that. You need to be able to have financing capabilities in place to solve for that, and the full ecosystem. So it's healthcare practitioners, its capabilities and skill sets, its infrastructure needs, and it's then thinking through the sustainability of that model over a long period of time. And even today, it's very, very tough to be able to manage that as you think through your primary, secondary, and tertiary care systems in a country.
And I'd imagine that infrastructure should be one of the major challenges, especially on the continent. I mean, South Africa alone has a major burden in relation to that.
Definitely. Infrastructure is definitely one of the key areas. And then the other is definitely the brain drain, thinking about practitioners that are abroad, the diaspora, bringing people back, and to be able to serve, the people of the country and the continent. That's definitely something that's very challenging.
So you're talking about new models of delivery just with regards to healthcare. Let's start with primary healthcare.
Sure.
What are we looking at?
So I would say, some of the new delivery models that we've been looking at specifically from GE Healthcare is really considering taking adapted technologies and then taking that closer to the village and to the rural communities of the countries to be able to partner with the government to solve for those diseases. So just a simple example, if you focus today on maternal newborn health, out of every 1,000 live births today, there's approximately 60 deaths. That's 5 times what we see in Europe. So we partnered with governments today to take a portable ultrasound device called the V-Scan. We trained midwives, and we were able to deploy those technologies together with education and training close to the home. So if you think about a mother-to-be, she's going into an antenatal screening, she's going to be quite nervous, she goes into the healthcare center, and today she has the ability to be able to be scanned on a portable ultrasound device. So the ability to help the patient, you can triage, you can then be able to see what is the expectant mother to be experiencing. Is there a multiple birth? Could there be a breach? And then you will definitely have a protocol that is in place with the government to be able to send that patient to a secondary care facility.
So there is lots of innovation. I mean, I recall the AmbiFlow that was launched by the health department. And I mean, that was quite exciting, the fact that you have actually a virtual room for a child to be able to rest in. But part of the problem is what you raised, the issue of high-skilled practitioners. And we've seen so many cases, even recently, not only of negligence, but also lack of knowledge. Why are some things that are so basic still continuing?
Well, I think that it's obviously very challenging in terms of this developing on education and skills development across the country and across the continent. I think, but at the same time, we also have some very, very good specialists and skills and people that are delivering on that model today. I just think that it's very challenging to be able to maintain that on an ongoing...
But what is the challenge? Is it the cost? Is it? I know you spoke about the brain drain as well, but if you already have a core of professionals that are already here, there must be some basic protocol that must be followed.
Yes. So in the specialist areas, there's very much a protocol that needs to be followed and a process that takes place where healthcare practitioners are trained to be able to manage that. I think that obviously just the ability to have that at scale is something that's quite challenging. So to have the same kind of protocol followed across the country at all different levels of care, to be able to make sure that you can deliver that level of quality that's desired. And I think that's what's important. So making sure that both within the public and private sector to support that model, it requires consistent education and training. So GE Healthcare has developed 4 training centers across the continent, one in Algeria, Egypt, Kenya, and South Africa, very much focused on training. So doctor-to-doctor training, providing certified professional development points, being able to certify and support midwives, radiographers, sonographers, and technologists to be able to make sure that that quality is there. I think that's really, really important.
So one of the themes you had there was the future of healthcare is female, but it was a question, and I asked myself, why is it a question when it is so obvious that the first responders on the front line are women?
That's true. That's very much true. So I think that, you know, women are really, really important in the healthcare system, and, you know, they're very nurturing, very supportive, and we see a lot of women in the workforce today. In actual fact, there was a presentation that was delivered today by Mediclinic that was showing just how important women are in the healthcare workforce, and showing how they're busy working in terms of upskilling and employing much more women, which is good to see.
So how do they influence the new delivery models, and not just only in the boardroom as in having greater influence there? What can be done from the perspective of African women on the continent in improving primary healthcare all the way up?
Yeah. In what we see today, especially specifically working in maternal newborn health, we see a lot of midwives that are trained. Most of those midwives on the continent are women, and we are supporting those midwives to be able to deploy and develop those skills. So just within the last 18 months, we've worked with 18 programs across 7 countries in Africa, and within that we've had over 150,000 women that have been touched in terms of actually expectant mothers, and very proud of the fact that we've developed that training and supported 1,500 midwives to be able to deploy that training. So I think we're quite proud of that in terms of what we've done across the continent.
Is there consensus about the delivery models? You spoke about the complexities, obviously, that we face as a continent with regards to healthcare. Is there consensus on the delivery models and what needs to be prioritized?
I would say consensus is an interesting word, because I think that you're always going to need a system to be challenged. And I think that's what we're there to do. We're there to be able to think through how do we leapfrog and think about how to deploy and when working in a system that is not necessarily working as well as what it could be. So how do we change the game on that? A very simple example is the utilization of digital innovative technologies. So healthcare IT is not just something that's connecting departments in a hospital, but you can consider that where you could have a patient's record being transferred from one hospital to another, having a referral doctor or a referral specialist being able to look at a patient's case. Just for example, just down the road at Nelson Mandela Children's Hospital, we have solutions there in place to be able to have pediatric cases being referred from one hospital in Johannesburg through to Nelson Mandela Children's Hospital.
I'm just curious, is it easier for people, communities, to come up with innovative solutions when they're forced to, when they don't have the resources? Because I was actually just thinking about a case in Rwanda where there was an app developed where either they were delivering blood, much needed blood, at emergency level. So what forces us to that point to come up with those innovative solutions?
You're correct. I think the need, and you see, I think when you're on the ground and you really see, that there's a dire need to be able to think about things differently, and you see the people and the impact that it has, I think you really realize that people then really want to come back home or develop something locally that will serve their people. And that case specifically in Rwanda is actually used with drones. It's one of the only countries in Africa, we actually met that company that is actually utilizing drones to do blood delivery across the country.
So we're likely to see more drones in our healthcare delivery models.
Oh, perhaps that could happen.
Thank you so much for joining us.
Thank you.
Clyde Lewis, General Electric's Head of Healthcare. Let's take you back to Francis at the